Let's get into Kyro Corner. What do we got today?
Some more of that. We got something called Thoracic Outlet Syndrome.
Yep.
Basically, your Thoracic Outlet Syndrome is basically right up in here, right?
Yeah, so it's basically, within your armpit, you could get numbing, tingling, heaviness, weakness. There's different parts of it, and we'll get into all that right now. So let's start off actually just saying what it is and what some of the symptoms are that will come from it. So you get pain, numbing, tingling, any type of weakness or atrophy. Atrophy is like dying of the muscle, and you'll get a lot tiredness of the muscle. So a couple of the orthopedic exams that we do is, like Ruse. I believe it's Ruse. I always forget the name of it. Ruse, where you come up here and one of the hands will tire out faster than the other, and that's a classic.
I think on the orthopedic test they want you to do it for 5 minutes, but there's no way in heck I could do that for 5 minutes. There's no way anyone could do it for 5 minutes. I mean, something ridiculous.
I remember I thought it was 3.
I thought it was 5.
I don't think it was 5. I think it was 3. But usually if they have TOS, it starts to tire out after 30 to 45 seconds.
Yeah, right away.
It starts to tire out pretty quickly. So there's different types of it, and what could be helped or not be helped through either medicinal purposes, whether you have to do any type of surgery for it, or chiro, or physical therapy, or corticos, or so. I guess if you know where the origin of this TOS, thoracic outlet syndrome, is, then you know how to go about it. So let's break these down and say, hey, what's most common and how that presents itself, and then go from there. So the first one is neurogenic. Neurogenic nerves comprise 90%.
I get TOS sometimes, and I'll be literally sitting in bed sometimes, and I feel like numbness going into my pinky finger and my ring finger.
Yeah.
But after a good adjustment, it typically goes away.
Yeah. So, and when it's neurogenic, like you just said, the symptoms that you get pain, you get numbing, tingling, you get weakness. Like we said earlier, atrophy, dying of the muscle. But atrophy doesn't kick in quick. Like people, it takes a long time for a muscle to die off. You're talking years, minimum, 5 to 7 years? Minimum?
It takes a while
for that to happen. So you have ignored all those other symptoms. So you ignored all those other symptoms until basically you just stopped using it completely, and the muscle sort of starts to atrophy away at that point.
If it's caught, you only get to the atrophy portion of it.
Tiring of the arm and the shoulder and arm, especially when raising the arm. So that's the biggest telltale. Is like a lot of people, we get painters. We get a lot of people that work out a lot, which is it's more musculoskeletal at that point. But when they work out heavily, those muscles, the scalenes and the levators and all that get super tight.
Students, we see a lot too.
We see a lot. So just working on those areas will stop pinching off those nerves. I remember in school, we had to draw out the brachial plexus freaking 100 times to really know where everything went, where it originated from, where it's running to. And that's basically... brachial plexus is a bundle of nerves in the armpit area here. It's just an extension coming off the neck nerves in the neck. Cervical plexus is
5, 6, 7, 8, right? A little bit of T1 as well.
Yeah. So, and then that sits right behind here. So when you get this TOS, it could pinch off some of those nerve endings.
That was the biggest cheat in school. If you could draw out the brachial plexus with every single nerve that comes off it.
Yeah.
Everything.
And we had one anatomy teacher where our assignment every week, we had to turn in 5 new drawings. You had to use a different color every time. Like, he was real meticulous about it. Like, I could still draw right now just from memory. You know what I'm saying? Yeah, it was crazy. So, and then the next one is venous. Just veins compromise. It's only about 5% of the people that actually have TOS. It's not heavy. The biggest thing here is really blue tint in the fingers and edema. It's just swelling in the hands because the veins are choked off. And that usually could come from, once again, in the axillary artery, or anything going on in the pec area or around the glenohumeral joint in that area there. Painful tingling in the fingers, that could be mixed for either one of them. The edema and blue tint is the two biggest things there. Also, the other one that you look out for is the veins bulge a lot more in the shoulder and the neck. So you'll see, they're not really varicose veins, but you just see that they're more prominent. They're way more prominent in that area, and that gives you that, along with the numbing, tingling, and blue fingers, will give you that TOS diagnosis at that point. Arterioles only comprises about 1%. It's not very common for that to happen.
No blood flow going to the area.
Yeah, and that's basically exactly what it is there. Raising your arm over your head, raising the arm over the head, obviously you'll see that paleness comes into the hands quicker. And that's just another arterial area of the TOS. The scariest thing about that is blockage, man. if it's arterial, chances are there is a blockage somewhere in that area, and that needs ER, that needs your medical doc, that's their world. So that's something that
then you start getting like a schema of things.
Yes,
things start dying off.
A schema. Explain a schema. You said the word. You gotta say it now.
A schema is basically when there is a portion of the body that doesn't have sufficient blood flow going to that area. Sometimes we see it in strokes. Potentially happens where there's no blood flow going to the brain, so you could have a stroke.
Yep. So those
schema is not a fun thing.
Those are just once again, if you know what you're looking for, just gotta be knowledgeable. You gotta know what you're looking for. And if you don't know what you're looking for, that's fine. Get to somebody that knows what the heck to look for. You know what I'm saying?
And they'll send you to the right direction.
100%.
Like somebody walks in with some sort of arterial TOS going on, we're gonna send you out.
You're gonna send you out.
We're gonna send you to someone that can
for sure
help you better than we can.
Yeah, we got some of the causes I mentioned earlier. If you got a cervical rib, and that's just a congenital anomaly. Congenital anomaly just means you're born with it, accidental finding. We have no idea that it's there unless you have like sprangles or anything like that. But with the cervical rib, it's literally your first ribs that attach into your T1, your first thoracic segment for first thoracic vertebrae. It attaches to the C7 typically. And that goes to the point where it just chokes off those bundle of nerves. Other one is like tight muscles. Like I said earlier, pecs, scalenes. Those are huge. That could be very tight and choke off that bundle of nerves called your brachial plexus. And that's just that brachial plexus supplies everything from the neck down to the arm. So that's where something you end up looking at that, and you got to see where that's getting choked off at that point. Bodybuilders, huge. They got overgrowth of those muscles.
Super big, so everything
compresses. So everything starts to compress at that point. Repetitive overhead motion, your swimmers, your painters, your baseball players, your hairstylists, mechanics, those are all up here or up here. Dental hygienist is another big one.
Yeah,
I get a lot. Yeah. They're so fixated on making sure that the patient's comfortable that they don't pay attention to their own posture at all. So dental hygienists and dentists are huge with this. A lot of hunching over, a lot of just arms up here trying to get comfortable trying to get the patient comfortable. So that's a big one. And then God forbid anything, if none of those check out, you got to be concerned. Abnormal findings, you got to be worried about like a tumor or something compressing on that bundle of nerves causing this TOS. So these are just all things. How do we help typically? When it's neuronal, when it's within the nerve, finding where the origin of that nervous system impingement is and trying to relieve that area, whether it's helping out with the muscles, with myofascial cupping, scraping, exercises. PT would help great with that, especially if it's muscular. Opening it back up. If it's more joint out of place, like your SC joint, AC joint, a glenohumeral joint could really affect into the pec because that's where they all come in and attach. We would just realign that, and then go from there.
Yeah, a lot of people that like break their leg, for example, a lot of people are on crutches, and that is actually something that you get a lot of compression out. A lot of times what people do is they have the actual crutch in their armpit compressing. You don't want it specifically in your armpit compressing.
Where are you putting it?
A little bit of space in between your armpit.
Yeah. I mean, typically instead of digging into the axillary area, you want it sort of like not mid-pec, but like bottom third or top third. I'm sorry.
I think you want about like 2 inches between the armpit and the crutch.
Yeah.
Majority of people have their crutches wrong, the way they're using them. A couple of times I've seen patients come in where it's literally dug up into them and they're so uncomfortable crouching. And I'm like, how about we lower this a little bit?
Yeah.
And as soon as we lower it, they're like, oh my God,
it feels so much better. And that's so a lot of them, like, truthfully, it's weird because you should just be doing like a tricep dip every time, not literally digging into your armpit. It could choke all that off.